You're watching Baptist Health's Resource Live, where our respected experts bring you timely and practical health and wellness information to improve your family's way of life. We're healthcare that cares. This is Resource Live.
Hello, everyone. I'm Nikki Mohan, a veteran TV journalist and mom. Becoming a mother, as we know, can bring on a range of feelings, and not all of them necessarily feel good, right? Because moms and moms-to-be, though, they deserve the best, including the very best of mental health. In fact, today is World Mental Health Day, a day meant to raise awareness that any mother or mother-to-be can suffer from anxiety, mood disorders, and depression. There's also general stress and worry that comes with being a mom. Is my child sick? Does he have friends? Is she eating enough? Is he happy? Are they eating too much? I mean, forget about it. The list goes on and on. We brought in the experts to talk to us about managing the mommy mental load. I'd like to welcome all of them right now. Dr. Paola Bordoni. She's an OB-GYN. Welcome, Dr. Bordoni.
Thank you very much for having me.
Oh, it's going to be a pleasure. Jennifer Gonzalez, licensed clinical social worker at West Kendall Baptist Hospital.
Thank you very much.
Thanks for being here. We also have Dr. Carrie Ann McDonald, oncologist breast surgeon at the Lynn Cancer Institute. Good to have you here, Dr. McDonald. Thank you, all of us, for joining us here today. Well, before we dive into today's subject, I want to remind all of our viewers, this is about you. So send in your questions, send in your comments throughout the segment. We're always here for you. We're happy to answer any of the questions you may have. These experts, they can handle everything. We're going to start with Jennifer Gonzalez. Today is a Mommy Mental Health Day. I mean, I thought that was every day, right? Motherhood and the months leading up to becoming a mom, extremely stressful and anxiety ridden. How important is it for moms and moms-to-be to stay on top of their mental health? And of course, we want to ask you, how do you do that? So much to worry about. We're nesting, we're growing a being.
Yes, it's a lot to take in. Making mental health a priority is extremely important. Just as we prioritize our prenatal visits and our annual appointments, we must prioritize our mental health. There are a few ways as mothers we can reduce our mental load, such as, you have to understand, we're not super moms. Things will not always run smoothly or perfectly. We need to ask for help and should not be afraid or embarrassed to ask for it. Sometimes that means we have to revisit our household roles, and that's okay. We need to feel comfortable saying no, and we cannot always tackle everything. So I'm going to do a quick little story to let you know what happened to me. New mom, didn't know what I was doing. Tried to keep my baby on a routine, bath, bottle, bed. Very simple. But every night doing that was a lot for me. My husband was working. Every once in a while I would think to myself, why isn't he offering to take over that kind of routine for me? And crying to a friend, she looked at me and said, have you asked him? Have you asked him to help? And a simple thing like that. And I said, no. And I asked, and guess what? He was more than thrilled to help me out. He was so excited and said, I thought this is what you wanted to do. You wanted to do it your way. You wanted to make sure nothing was messed up. I'm like, no, please take her. And that was such a great bonding time for him and my daughter. And it was also a chance for me to breathe, to take a breath, sit back and breathe. So
you mean men are not mind readers?
No, surprisingly enough. And sometimes as moms, we think we're supposed to handle it all. And we don't have to, especially now during the COVID pandemic. We're actually being teachers now as well, some of us. So it's okay to ask for help, and you'll be surprised at the positive reaction you get when you actually do ask for it.
Great advice. Now, pregnancy can be one of the most special times in a woman's life, as we know, and also full of nervousness and apprehension, as we spoke about with Jennifer, especially during a pandemic. How important is prenatal care? For that, we're going to go to Dr. Bordoni. And how should women handle a pregnancy, especially during these times of COVID?
Good morning. So definitely prenatal care is of utmost importance. It's not only prenatal care, we also talk about preconception. You can go to your OB-GYN and get advice regarding preconception care. It's important to have your comorbidities under control. Prenatal vitamins is something that women should start taking before they become pregnant. Usually we want 30 days of prenatal vitamins before getting pregnant. We want patients to be at their best weight and best status in terms of their mental health, especially nowadays with the pandemic. We have an upstroke of patients with depression and anxiety. It's very important that patients be prepared for the pregnancy mentally also. It's going to be a little bit different because we've had a big change in things that some women feel is very important, such as their baby showers, they're celebrating with their family, the gender reveal parties. All these things have changed now due to pandemic. Some women are feeling a little bit different than they have in previous pregnancies. So preconception care, being prepared emotionally for what is to come. And then prenatal care, we usually like to get patients in around 7 to 9 weeks. Why? Because that's when we get their first ultrasound to kind of date the pregnancy. Dating the pregnancy is very important. From that point forwards, we do a lot of blood work to make sure that the patient is doing well. And then one of the very important things is genetic testing. There are windows in the pregnancy which are most important to do the genetic testing appropriately. We don't want patients to feel that because there's a pandemic going on, that they need to delay their prenatal care because they're afraid to come to the doctor's offices. We want them to come in on time so that we still have time to do the genetic testing that is necessary. So the other thing is to keep in mind that most of the doctor's offices, such as my office, we are still having patients wait in the car before they come in. We're having the temperature checks. Everyone has to wear masks. And there are some things a little bit different from previous pregnancies for patients. Some of them might be a little bit concerned because they feel that they can't come to their doctor's appointments with their loved one, for instance. We're having the women come in. We usually aren't having their spouse come in or their loved ones come in during the visits any longer because we're trying to minimize the traffic in the offices. But that's what we have that's what we have FaceTime for. That's, we get these patients, we get their loved ones who are sitting in the car, we get them on the phone, and we have to have them come in, we do. So definitely prenatal care is important. Get you in early, take good care of you, make sure that we're visiting patients frequently. We have them come to the office with limited visits. Anything that can't be done in the office is it needs to be done in the hospital. The hospital is allowing one loved one to go in for certain situations. So sometimes the hospital may be a scary situation for some patients, but most hospitals are allowing their loved ones in for that sort of thing. So definitely come in, see your doctor, and any concerns or questions, we're always an earshot away. Now, let's say somebody becomes COVID positive during pregnancy. If that were to happen, we will oftentimes, for our office, for instance, the doctor is calling these patients daily. We're monitoring them very closely. And then they come to the office once they're cleared or they're able to come in. And if they need something done that has to be done in a certain window, we're telling them, okay, you're COVID positive. We're going to take you to the hospital, to a designated location where whatever needs to get done gets done, and then you go home.
Wow.
So.
All such complicated issues, especially during this pandemic, but you explain them so well. Can pregnant women get the vaccine, Dr. Bordoni? What does the science say about that?
So currently the data is limited. We don't have studies currently on pregnant women. We have some smaller studies on breastfeeding women and vaccination in breastfeeding. In terms of pregnancy, this is a discussion that needs to be had with the individual and their physician, dependent on their comorbidities, dependent on their exposure risks. Some patients are healthcare workers. Some patients are sitting at home working from home. So currently the recommendations are to have a one-on-one conversation with your healthcare provider to determine if the risks and benefit ratio, what is the best situation for you. Right now, we feel theoretically that pregnant patients are fine to receive the vaccination. We haven't seen any risks or any complications, but we will tell you that that's limited evidence. We don't have the studies to back this up yet, but I do feel that in the upcoming weeks, we will see a change in this. There were a couple of studies that recently came out demonstrating that patients that are being vaccinated in pregnancy, their babies are demonstrating positive antibody response. So Everybody nowadays know what antibodies were. Back in the day that, nobody knew. Now with COVID, everybody knows what antibodies
We
are.
learned a whole bunch of new lingo. Thank you, Dr. Bordoni.
No
Most
problem.
importantly, patients need to talk to their doctors and see them and follow all their visits. Now we go to Dr. McDonald to talk about cancer. It is unfortunately a reality for many women and mothers across the country, especially breast cancer. Specifically is the second leading cause of cancer death in women in the US. And as a mother, one of our constant worries is, will we be there to watch our children grow and be there for all the momentous occasions that we look forward to? How essential are cancer screenings, and can they help prevent certain cancers like cervical, breast, and lung cancer, Dr. McDonald?
Thank you. So regular cancer screenings are very important for detecting the early signs of cancer, so you can treat it as early as possible. And I always tell people early detection is really the key to better outcomes, because better outcomes means that as mothers, we're going to be around longer to share in those momentous occasions with our children. So the key to cancer screenings are really to detect cancer before there are any symptoms. And so in order to do that, we have to be advocates for our own health, and we have to go for our annual checkups. So many women will skip their mammograms, for example, or skip their annual screenings because they feel fine. They don't have any symptoms. They're doing well. But I think it's important to remember that you want to catch cancer before you develop symptoms. You want to catch it at its earliest stage so that you have a good shot of having a very good prognosis and better outcomes. And so, for example, mammograms can detect breast cancer early and is the only screening test that has been shown to decrease your mortality from breast cancer. Lung cancer is the second leading cause of cancer death among women. And, lung cancer hasn't really inspired a lot of advocacy or activism because it's often viewed as a condition that smokers bring on themselves. But no one is immune to lung cancer, even non-smokers. And so, low dose CT scans have been shown to decrease the mortality from lung cancer, and that's what's used sometimes as screening. In terms of cervical cancer, that's another one that women want to make sure that they go for their screenings for. You don't want to miss your Pap test, your HPV test, and all of those things. So I think cancer screening is certainly very important, and early detection is key. We have a very comprehensive breast cancer center here. And when people come for their mammograms, we also ask them about their smoking. We look for vascular calcifications on the mammogram to see, because there's an association between vascular calcifications and coronary artery disease. So women's health is really like a top priority for us, not just breast cancer, but everything in general. So we try to screen for those things. So I think it should be their number one priority as well.
No, absolutely. As a mom, it's like, again, we're irreplaceable. And that's why at Baptist Health, they're offering special pricing from May to June for patients without insurance, $50 screening mammograms and $100 diagnostic mammograms are being offered. Visit baptisthealth.net/breasthealth. I recently got my mammogram done at the Baptist Diagnostic Facility in Plantation, and it was a very simple experience. It was very well coordinated for COVID. You were in, you were out, and the staff was extremely accommodating and made it very comfortable to do. It is really, it's easy to say, I'm not going to get my mammogram because I'm busy with everything else. But this program makes it affordable. The staff at Baptist makes it a comfortable experience. That diagnostic center is amazing. And, it's really, really important. And you breathe a sigh of relief when you're done because, you're like, listen, I checked one thing off the box that I don't have to worry about right now because I want to be around. I want to be around for my kids. I was able to schedule my mammogram a few weeks ago, get in, no problem. I already have my results, and I'm very thankful that it's normal. And I appreciate everybody there at Baptist Health in Plantation. Well, we've covered cancer screenings, Dr. McDonald, but many people have delayed wellness in general for fear of being exposed to COVID at the doctor's office and hospital. But as we've heard from Dr. Bordoni, as I saw with my mammogram experience, it's not an issue right now. We figured this out. And that's so critical for people to stay on top of their screenings. So people shouldn't really consider delaying their healthcare, should they?
No, they shouldn't. I mean, the pandemic has certainly caused widespread disruptions in preventative care, I think, across the healthcare system. And I think that the pandemic has really given cancer the advantage, as we've seen that cancer screenings have decreased as a result of that. Screenings did come to a halt last year when we were trying to limit the spread of the virus. And once screenings were resumed, people were scared to come in, just like Dr. Bordoni said, for fear of contracting the virus. And I think, again, it just kind of brings home the point that early detection is key to really beating and fighting cancer. And so, for most people, when they go for a mammogram, a routine screening mammogram may be negative. But there is a subset of patients who will have an abnormal mammogram, and that might be their first sign of breast cancer. And so it's that subset of patients that's going to have a delayed diagnosis. And, we don't have the research now to show how COVID has impacted cancer statistics in terms of stage for stage, how people are doing. And so I think many healthcare facilities have COVID protocols to make patients feel safe when they're coming for their mammograms or visiting their doctors for their healthcare screenings. And so I would encourage people to stop postponing their healthcare screenings and go to the doctor. And more importantly, consider getting the COVID vaccine so that you feel more safe and more comfortable kind of getting back out there into the environment so that you can be on top of your health.
All great advice. Dr. Bordoni, we've talked about pregnancy and everything that comes with it. Let's talk about childbirth, the big moment, what moms-to-be should know about labor and delivery and how they can prepare for one of the most important days of their lives. I shared with the rest of the team, my grandmother had 12 kids. I had one, and it was the hardest thing in my life, childbirth and recovering from it afterwards. So please, all the advice for moms-to-be, we're ready for it.
And number one, don't have 12 kids.
And if they do, don't come to your office. I'm kidding.
Yeah. Or just don't bring the kids with you. This is one of the most exciting days for people. It's a day filled with emotion. I tell patients the day that you come in for delivery is you have anxiety. You are nervous, you're scared, you're excited, you have this multitude of emotions. So patients always say, how can I prepare? If you want to prepare for childbirth, I think one of the best things to do is be open-minded. Be prepared in terms of be educated as to what can happen, but we need our patients to be open-minded. I think the pandemic has really created a situation that has assisted in patients doing this. Now patients, they just come in and they say, doctor, do what you got to do. I leave it in your hands. Nowadays, patients, they understand that the physicians, we're here, we really are on your side. We're here for you. We're here to prepare you. So one of the things, for instance, birth plans, patients used to come in with birth plans. I don't recommend people have birth plans because delivery is not a black or white thing. It's a gray zone. Anything could happen. So what should you do? Go home, create a birth plan, but use the birth plan to educate you, not to really come in with the birth plan and say, this is what I want to do. There's no way that you'll know for sure if you're going to end up with an episiotomy, or if you're going to get the epidural, if you're going to end up with a C-section. Of course, you can say, hey, doctor, I'm here. I want to talk. And that's what we're here for. We want our patients to talk to us. Talk to your physician, talk to your nurse, tell them, these are the things that are important for me. I want the epidural, or I don't want the epidural, or I don't want this, But understanding that sometimes we have to do things. Maybe you won't be the fortunate one that gets the epidural. I do tell my patients, though, you're not going to end up with a gold medal at the end of the day if you do it without an epidural. So, you need to be open-minded and be understanding. In terms of the hospital policies and rules as to what's going on now with COVID, it is changing minute by minute. Something could be going on today where you're allowed to bring a loved one in today, and tomorrow it could be that you're allowed to bring in 3 loved ones. We really don't know. So preparing for the delivery, be open-minded, be educated as to what will happen. If you are unsure, you ask us. That's what we're there for. We will talk to you for hours, explaining to you what is going to happen and communicate with us. I really don't want an episiotomy if I can not have one, but understand that if there's an emergency, we're going to do that because we're here for you. So really prepare yourself for everything, for all the possible scenarios, and try to enjoy it as much as possible. The hospital is allowing a loved one to come in with you. That whole thing where nobody was allowed to come into the hospitals with you, that we never really saw that happen. We've always had husbands or significant others or loved one, at least one person in there with the individual. And be prepared to be there, be with your baby. Baptist is a community and environment where the baby is delivered and immediately placed with the mother the entire time at the hospital. And then most importantly, just ask us questions, because that's what we're there for, and enjoy the ride, however tumultuous it may be.
That's all awesome advice. I don't think you would have wanted to be my doctor, because I knew my baby was going to be 10 pounds. I was like, I'm not pushing, just take this out. I want to point out that Baptist Health offers a variety of educational resources for mothers to be and new parents at all of their hospitals around the network. Go to baptisthealth.net/maternity. You can always find a list of childbirth classes and parent support groups to help guide you and your partner through the new and unknown. We're going to go back to Jennifer Gonzalez. Pregnancy check, labor and delivery check, your newborn's home, and a flood of emotions comes crashing down on you as a new mom. Let's talk about postpartum depression. How serious is it? How do we detect it? What symptoms should new moms look out for?
Okay, so postpartum depression is one name you may hear for depression and anxiety that can happen after pregnancy, although it might not be the best way to describe what women actually feel. The word postpartum means after birth, so postpartum depression is talking about depression after the baby is born. For many women, they actually can start feeling depression or anxiety before the baby is actually born, and it continues within the first year that they've had the baby. So depression, anxiety that happens during pregnancy or after birth are real medical conditions, and they affect many women. So women should reach out to their OBGYNs if they begin to notice signs of depression or anxiety. Some signs of depression and anxiety are extreme sadness or being angry without warning, foggy or having a hard time completing tasks, being robotic, feeling like you're just going through the motions, being very anxious around the baby and your other children, feeling guilty like you're failing at motherhood, and unusually irritable or angry. You also may feel little interest in doing things you used to enjoy, and scary or upsetting thoughts that don't go away. So postpartum depression affects the entire family system. Your partner is going to feel the results. Your other children are going to be feeling the results. So it's something that we need to talk about, something to let our partner know to call us on. I feel like something's not working out with you. Can we talk about it? And then when you notice these feelings or someone brings them up to you, something going different with how you're acting, please take it to your healthcare provider. We have amazing physicians within Baptist Health and in the community. And we can also use our mental health services through telehealth. So anything you notice feeling a little off or upset or can't manage, we ask that you please speak to a healthcare professional so we can help you through this.
If I'm locking myself in the pantry, it's time to get help. It's time to get help. The Dr. McDonald, time is something mothers complain they don't have time for, right? We never have enough time for the day, juggling family and work. There's always something to get done. During this pandemic, telemedicine has really helped us stay on top of our health. When is it necessary to see a doctor in person? And I hope telehealth continues, because it really has been a blessing in so many ways, but we need to see you at some point, right?
Right, exactly. I mean, telemedicine is not new, but it has certainly changed the way that healthcare is delivered. And I think as busy mothers, it is convenient because it helps to kind of mitigate the challenges of scheduling, worrying about childcare, traveling in rush hour traffic, gas money, all of these things. And for some people, as we've kind of echoed already, it kind of ameliorates some of that risk of contracting COVID by going to the doctor's office. And the other nice thing about telemedicine is that it can be done at any time at the discretion of the physician. But despite the benefits, there are patients who need to be seen in the office. And so, for example, in my specialty, I like to see patients who have a new cancer diagnosis, really for anything that you need a physical examination. So if someone has a complaint of a new lump or nipple discharge or something that you really can't do on a face-to-face encounter, I like to see in person. And I'm kind of one of those who likes the personal touch that you miss a little bit with telemedicine. But I would say anything that concerns you, anything that a physical exam needs to be done should be seen in the office.
Yes, no, absolutely. Dr. Brenner, you touched on this before about the COVID vaccine, because vaccines are another way of preventing certain illnesses. But why is it critical that pregnant women stay on top of all of their vaccines, and what other vaccines should they be sure that they have received, especially during pregnancy?
So there's certain vaccines that are actually contraindicated in pregnancy and certain vaccines that are actually recommended during pregnancy. We talked a little bit about the COVID vaccine, and we alluded to the comment of antibodies. So one of the reasons for receiving vaccines is for an antibody response. What does an antibody do? An antibody is something that's created in your blood that when a viral particle is introduced into your body, it grabs it and gets rid of it. Therefore, you don't actually get infected with the disease. So there's different types of vaccines that work by doing the same thing that are recommended in pregnancy. One is called the Tdap, which stands for tetanus, diphtheria, and pertussis. It is safe to receive in pregnancy because it's basically a toxoid. It's not actual virus that's going into the system. And why do we give it? Because we want pregnant women to receive pertussis vaccination so that they create antibodies to this, and those antibodies are then passed on to the baby. And some patients will say, oh, I'm good, I received the Tdap vaccine within the past 10 years, which is usually what we do. You get a booster every 10 years, but in pregnancy, it's different. So in pregnancy, you want to receive it with each pregnancy. And the reason is because we're just basically using the woman's body to create those antibodies to pass them to the baby. So then the baby during the first 6 months of life is protected from getting pertussis, which is the whooping cough, during the first 6 months of life. The baby will receive its own vaccines if you choose to do so at 2, 4, and 6 months of life. But those vaccines that the baby receives don't receive a complete antibody response. So the mom's antibody is protecting the baby from the whooping cough, which can be serious. It's a cough where these babies have these coughs that will put them in a point where they can't even breathe, and they'll sometimes vomit, they'll become a loss of consciousness due to the coughing spells. And the other one that we do recommend too in terms of vaccinations is the flu vaccine. During the flu season, we'll recommend women get the flu vaccine, but we do the vaccine. We don't do the nasal spray. That one's actually not recommended in pregnancy. So we do recommend the flu vaccine in pregnancy, mainly because pregnant women being in a temporary immunocompromised state, if they were to become flu positive, they can actually develop severe symptoms that some others would not, or that you would not if you weren't necessarily pregnant. So due to those risk factors, we do recommend pregnant women receive the flu vaccine. So those are the two main ones. There's other ones that are more dependent on the individual. If you travel for work, hepatitis A and B, those sorts of things. But the most important really are Tdap and flu vaccine in pregnancy.
Pregnancy is such a delicate time, so important to stay on top of the health with the experts. And Jennifer Gonzalez, they tell us all the time in the safety video, put your oxygen mask on first if you need to put an oxygen mask on before you put them on the kids. That translates into real life, doesn't it?
It does, and that's a perfect way to explain self-care. So self-care, whether physical or mental health, it's not selfish, it's essential. When you take care of yourself, you build your mental resilience and strengthen your ability to support those who depend on you. So we as moms need to take time for ourselves. Let me repeat that. We need to take time for ourselves and allow ourselves the ability to have a mental health timeout. So it's almost giving yourself permission. So daily timeouts or self-care is something you can do to protect your physical and mental health daily, even if it's something short. Doing a short breathing exercise. We have all these apps on our phones. Take a walk, an uninterrupted bath. Not one where you're having knocking on the doors and a kid coming and seeing how long you're going to be. An uninterrupted bath, or even going out to get our nails done. So again, we got to take care of ourselves so we can better take care of our families.
That's right. Self-care is not selfish. Ladies and gentlemen, ladies, thank you so much. This has been such a great conversation. You've given us some amazing information from your expertise to share with our audience. We thank you for all you're doing to take care of all the moms out there. Remember, viewers, you can always connect with us on our social media channels, Facebook, Instagram, Twitter, and LinkedIn. You can also check out our resource blog for the latest news at baptist.health/news. You find a link there to all the episodes of the Baptist Health Talk podcast as well. On behalf of everyone here at Baptist Health, we ask you to please stay safe and do your part to stop the spread of COVID-19. Mask up, South Florida.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Resource Live is brought to you by Baptist Health South Florida, healthcare that cares.